everyone. Thank you for joining us. This is Public Health 101, where we have different programs come on and join us to share the great work that they are doing. So today we're going to be hearing from Suni. She works with the Adolescent School and Reproductive Health for Department of Health. Suni, if you could introduce yourself and just let us know where you're located in the department, and then feel free to take the floor.
Sure. Thanks, Jen. Hi, everyone. I'm Sani Puntavong. I am the Program Administrator for Adolescent School and Reproductive Health Programs at RIDOH. I also serve as the Deputy Chief for the Center for Preventive Services. I have been with RIDOH now for 12 years. It's weird when you say it out loud. And I sit physically at RIDOH in room 302. So if you are facing the elevators, it's immediately to your left in the corner. Feel free to come and visit anytime, or you can, my email is going to be at the end of the presentation, so feel free to reach out. So I'm going to talk to you about our Adolescent School and Reproductive Health Programs a little bit more, some a little bit more than others, talk to you about some of our program priorities and our activities, and hopefully the sharing will work. So let's try. Okay, hopefully folks can see the slides.
You're good.
Great, thank you. So as I mentioned, I oversee Adolescent School and Reproductive Health, which are really three distinct yet strongly related program areas. That's why we've organized them into one unit. Our unit is located within the Center for Preventive Services in the Division of Community Health and Equity. This is our team. We have coordinators who are dedicated to adolescent and school health, reproductive health, family planning. We have a school nurse consultant. We have a program associate who works on a lot of adolescent health and youth development activities. We are hiring for an evaluator. So if anyone knows anyone who's looking for an EPI evaluator position, please keep eyes out. We also have clinical consultants. Our consultant medical directors are Dr. Jennifer Levy and Dr. Jordan White. We also have another school nurse consultant who works with us on a consultant part-time basis, Linda Mendoza. So I'll start by talking about adolescent health. Really broadly, our mission is to promote comprehensive, coordinated, and equitable systems of support for youth and young adults. Those systems should support the power of youth and young adults as they navigate a dynamic stage of development, actively directing their own lives and positively impacting their communities. It's a big, broad mission, but because adolescent health is big and broad, it is not like a lot of other discrete program areas that you often find within RIDOH. For example, reproductive health, which I also manage. Adolescent health is a life stage. So adolescence is a life stage, and oftentimes the work that we do, RIDOH does, related to adolescent health, does not live just within our adolescent health program. I'll talk a little bit more about that later. But we do think about how we can support young people to be successful and to thrive, and how we do that within systems that are supportive and ideally coordinated. Ultimately, what we're trying to do is support healthy adolescent development, and recognizing that adolescent development includes physical, cognitive, emotional, social, and moral and values development, that young people are going through a really dynamic stage of change, that they are going through this myriad of changes in their lives and also developing their own values and identities and establishing social relationships that are very important to their personal growth and development as well. So providing this context of also the breadth of different supports that are needed to hope that we make environments that allow young people to be as healthy as possible. And with that, we use a positive youth development framework to really think about how we approach initiatives to support adolescent health. You can kind of see this very large, complicated looking Venn diagram. It says up top, if in case you can't see them, it says assets, agency, contribution, and enabling environment. What we're really trying to think is that we are thinking about taking a more strengths-based approach to supporting the strengths and development of young people, so that they have the agency, the individual development to develop their own identities, develop their own agency to self-direct and make healthy decisions for themselves, for them to have opportunities to engage and contribute to the work that we do, but also have enabling environments, which means that we are really supporting connectedness, building on access to services, ensuring access to positive relationships, really thinking about opportunities. And kind of having this positive development framework versus what is often more a harm reduction deficit model approach to a lot of work about reducing risk. But we really want to think about developing assets, which hopefully then lead to young people making decisions for themselves that will reduce risk, that, you know, are leading them to make healthier decisions and enabling environments that allow them to do so. So how we do that at RIDOH, as I mentioned, many of the initiatives that we do for adolescent health do not live within the adolescent health program. We certainly do work on adolescent health and really are focused on making sure RIDOH has a coordinated and cohesive response to supporting adolescent health. But as you can see there, this is not even a full representation of all the work that RIDOH does related to adolescent health, but a lot of it lives across many programs. That there are school-based programs, community-based programs, statewide programs, with the caveat that, you know, certainly some of the school-based programs happen statewide, or community, you know, that statewide programs happen in communities, all that kind of understanding that obviously things run across the gamut of state versus school and community, but that these are kind of the centralized locations for each initiative. But you can kind of already see that there are a lot of different initiatives that reach adolescents, that support adolescents, that are funded or not funded in some cases, but are really targeted on making sure that adolescents in Rhode Island are as healthy as possible. So more specifically for our Adolescent Health Program, we work on a model of supporting program, policy, and partnership. We want to support implementation of promising practices and evidence-based programming. We want to promote systems, a systems approach for positive youth development that is inclusive of health equity, and to maintain and establish partnerships that really focus on collaboration, coordination, aligning priorities related to adolescent health, and leveraging and sharing resources. So some more specific examples of our specific adolescent health program initiatives is we support implementation of a positive youth development model with community-based partners called the Teen Outreach Program. We support strategic planning for statewide adolescent health priorities. We support collaboration across RIDOH programs, across other state agencies. So that includes Department of Education, Behavioral Health, DCMAF, all our other state agency partners who also reach adolescents and collaborating with them, as well as, of course, our community-based partners. We also really focus on a really intentional promotion of authentic youth engagement for RIDOH and partners. Part of the way we do that is through management of the Rhode Island Youth Health Ambassador Program, and also through development of youth-targeted communication and messaging. And we're talking about authentic youth engagement. We're talking about making sure that youth are engaged as partners as early on in processes that are planning or programming for young people. That it's not like we work on a program or a policy and then, you know, we're 95% done and we put it in front of a bunch of young people and say, what do you think about this? And say that we got youth input. At that point, oftentimes there's very little opportunity for change. So we really try to encourage programs to think about engaging young people as they would other partners as early as possible in program planning and policy development. So more specifically, how we do some of that is, for our purposes in our adolescent health program, we are funded by the Personal Responsibility Education Program with the HHS Administration for Children and Families. We fund 5 community-based partners to implement a positive youth development curriculum, which is called the Teen Outreach Program. It focuses on really comprehensive, evidence-based lessons that support young people in connecting to their environments, connecting to relationships, to building their skill set around healthy decision making. And there's also a strong community connectedness component with required community service learning hours. Another way our adolescent health program specifically supports Rhode Island and RIDOH for Adolescent Health is we are in the process of developing an Adolescent Health Strategic Plan, which is really intended to be a roadmap that identifies gaps, needs, prioritizes work, and thinks about how we're going to measure progress. So ultimately, the strategic plan is looking at what we want to achieve related to adolescent and school health, how we're going to try to achieve it, and then prioritizing some of that. Because as I mentioned, adolescent health is big and broad and has so many different moving pieces and components, and to affect all that adolescent development that I presented in one of the earlier slides, we would need to do a lot of different things, but ultimately we have to prioritize what we can reasonably and feasibly accomplish. And then how do we measure success and progress? So while this strategic plan has been in progress since pre-COVID times, we had made a lot of progress, and then March 2020 hit, and we have been slowly picking back up. But we are revving back up to kind of really finalize the strategic plan, but we were in process of conducting formative research to complete it. We're updating some of that now, but among that formative research included data review, so a really comprehensive environmental scan on the data related to adolescent health. It also included semi-structured key informant interviews with key partners who are serving adolescents and youth, community input sessions with youth serving professionals, so a more coordinated large group session with youth serving professionals to hear their feedback on key issues that are impacting young people's lives. And most importantly, we needed to hear from young people themselves. So we did that two ways. One, we did a youth health and well-being survey, which really was more to hear about from young people about what their priorities were around related to their health, what the challenges are for them to be as healthy as possible. We also did listening sessions, and we heard from over 100 youth about, again, like what the needs are for their health, what the gaps are, what the challenges are to them being healthy, or what does work well for them to try to be healthy and well. So we conducted listening sessions, and we are actually hoping to do more. We had conducted those listening sessions while the world was in early stages of the COVID pandemic. So certainly I think it was a little bit of a skewed presentation because young youth, as well as everyone else in the world, were really wrapped up in COVID. So we want to make sure we're hearing from young people about other things that are impacting their lives. Obviously, COVID and the pandemic made a big impact on everyone's lives, especially adolescents, but we do want to make sure we're hearing from them about other things that are important to them. We also did a survey of parents and caregivers because they are also really important to the lives of youth and young adults, and we really just want to make sure that we're hearing from them as well about what they think priorities are for young people in Rhode Island. So we are hoping to wrap up our strategic planning process by the fall, and updating some of this information and sharing out a framework for partners to provide feedback, and then actually writing the thing. So as I mentioned, one of the ways that we facilitate youth engagement with RIDOH, oftentimes when we're in meetings, I will hear, where are the youth, where are the youth, where are the youth, and absolutely want to make sure young people are able to partner and work with us. And one of the ways that we wanted to promote that with our Adolescent Health Program is to launch what we call the Youth Health Ambassador Program, so that when we are inviting young people to a space that is facilitated by RIDOH or other professionals, that they feel hopefully more equipped and supported to be able to contribute successfully in that environment. So the Youth Health Ambassador Program works with a cohort of about 15 high school age youth. We share more information about public health in Rhode Island, about how RIDOH functions, and provide opportunities for them to partner with RIDOH programs, and also to learn about public health careers and develop their own leadership skills. And I just also want to note that there is also another youth advisory council that RIDOH facilitates that is for youth up 14 to 24. And they also meet regularly and also serve as another opportunity for youth engagement at RIDOH. But among the two programs, we really try to support youth engagement with RIDOH programs and partners, and making sure that we're really intentional and thoughtful about how young people are reached as partners and leaders in the work that we do in public health. And it would not be a public health presentation without some data. So this is data that's taken from the Youth Risk Behavior Survey, or YRBS. Part of the reason why we want to think about all these kind of broader components, and back to that adolescent development slide, that there are a lot of different experiences that young people are having, a lot of changes in development that's happening in their lives. So we really want to consider the full measure and breadth of different data that impacts them. So thinking about mental health, which I think is high priority for everyone, and I think as the pandemic has only exacerbated all issues related to mental health, this data does need to be updated, the most recent YRBS data, but prior to that, in an average class of 25 high school students, 19 had at least one day in the past month where their mental health was not good. That's 76%. 8 felt sad or hopeless for 2 more weeks in the past year. 3 have seriously considered suicide in the past year, and 3 have attempted suicide in the past year. These suicide ideation numbers have gone up in pandemic times, as well as, their overall mental health and wellness. So there's just kind of a rising crisis that we acknowledge and recognize and are thinking about how best to address. And our violence and injury prevention program is taking the lead on that here at RIDOH, but then certainly this is a broader conversation that's happening statewide and nationwide as well. So we really just want to acknowledge the mental health experiences of young people specifically, and thinking about how we can better support their mental health and wellness. Somewhat related to that as well is their experiences related to bullying. 21% said they were either bullied in school or electronically in the past year. And kind of looking again below, sorry, there's a little bit of overlap with the text below, but also among those who were bullied versus those who didn't report being bullied, which is the gray area. So for example, felt sad and hopeless is that first one. In the red bar are youth who reported they felt bullied, and it's nearly 54% felt sad and hopeless versus 27% of youth who didn't report being bullied. And you can kind of see similar trends across the board for experiences and outcomes based on whether or not youth reported being bullied. So other things we want to recognize and take into account and think about. And then talking more about kind of health behaviors, 18% reported having a sugar-sweetened beverage 1 or more times a day, 28% drank water less than 1 time per day in the last 7 days, and 41% ate fewer than 1 serving of vegetables. This is thinking about, our physical activity and nutrition. This looks at physical activity measures. 47% played video games and used a computer or smartphone for 3+ hours a day, not including schoolwork. Only 21% were active for at least 60 minutes every day in the last 7 days. So really just thinking about how we're supporting healthy physical activity and nutrition for youth as well. And for sexual and reproductive health behaviors, we kind of see kind of stagnant, but also changes in trends for young people who have ever had sex. Was kind of fluctuates between increasing and decreasing, but hovers between this 35 to 42-ish%. But then we also look at that meaning relatively similar, but also safer sex practices slowly declining, hovering around the same point, but also not changing significantly in terms of young people who reported condom use at their last sexual encounter, but are also seeing slight changes and increases in birth control use. Something that we do have to kind of look at a little more closely is, young people, we recommend dual protection for safer sex practices for condom use and birth control, and thinking about that. So this is looking at teen pregnancy and birth rates. These have continually been declining. We do still need 2020 data, so this may have changed significantly in 2020, but that is possibly based on pandemic, but we still have to learn a little bit more about that. But traditionally, similar to national trends, teen birth and teen pregnancy have slowly been on the decline over time. And we attribute that hopefully to improved contraceptive use and making sure that young people have access to comprehensive sexual health education as well. So this is going to kind of be my transition, talking about teen pregnancy and birth rates. I'm going to talk more about our reproductive health and family planning program. We use the terms a bit interchangeably. Family planning has kind of been the traditional title for the program, but we're really talking more broadly about reproductive health at large. So ultimately, what our reproductive health family planning program is really elevator speech version is to ensure Rhode Islanders have the information and means to exercise personal choice in meeting their reproductive health needs. And again, we do that by engaging in policy development, systems coordination, community outreach, collaborative partnerships, and program activities. And ultimately, we're trying to support individuals to ensure they have access to high quality, comprehensive, affordable, and confidential reproductive health services. And that we really want to think about I want to really highlight here exercising personal choice, making sure that we are supporting individuals in meeting whatever their personal choices and individual needs are related to reproductive health. And just some examples of initiatives and priorities of how we try to do that is we support access to high quality, comprehensive, confidential, affordable reproductive health services supported by federal Title X family planning funds. We have worked very hard to implement what we call routine pregnancy intention screening and clinical social service and community-based settings. I'll talk a little bit more about what I mean about pregnancy intention screening, integrating preconception health within primary care and clinical specialties. I'll also talk about preconception care a little bit, making sure that the reproductive health we're talking about is inclusive, that we're inclusive of populations that are often underserved for reproductive health needs, such as individuals who might identify as LGBTQ+, individuals with substance use conditions, etc. That we're really talking about quality improvement when we're talking about reproductive health, that we're also constantly making sure that we are supporting clinical services to meet best practices and standards of care, and to do all of the above while we're promoting a broader reproductive justice framework. So making sure that we're promoting equity in that we are addressing systemic inequalities and inequities, and understanding the historical experiences of different populations, and what they've experienced related to reproductive health and reproductive oppression or coercion. So part of that, and again, I mentioned that family planning is kind of traditionally what this program has been called, is we want to think about where we're putting the planning in family planning. Oftentimes when we talk about family planning, it's about prevention. It's about prevention of pregnancies, about prevention of STIs, and what we consider other adverse pregnancy outcomes. So what we want to do is reframe our conversation around sexual and reproductive health, education, and counseling to be more proactive and intentional, to promote planning, and that understanding that planning can also be a plan for prevention. So someone's plan can be to prevent pregnancy, but the reason why we want to encourage a more planning, intentional, proactive approach is that we want to help clarify individual goals and wants, to understand their needs, so that understanding what someone's individual goals and plans are related to their reproductive health can help us best serve them, to address the needs that they have to meet those goals. How do we support them to meet the goals that they have? But first, we have to help them understand and think about what their goals are. So ultimately, with that, our priorities are, and I mentioned some of these already: pregnancy intention screening, what we call reproductive life planning, preconception care, access to comprehensive contraceptive options, healthy birth spacing, and doing that all within a reproductive justice framework, understanding that this is not the same for everyone, but what we're doing is trying to create systems that support people to meet whatever their individual goals are related to their reproductive health. So specifically, when I'm talking about pregnancy intention screening, what we're talking about is implementing routine screening questions that facilitate a conversation between a patient or a client regarding their pregnancy intention. It's really about helping to identify the preventive reproductive health care needs, and then providing appropriate follow-up services, whether that follow-up is contraceptive care, preconception care, a combination of both, referrals for follow-up, and that we really want to encourage people to ask it routinely. And routinely depends on the type of setting that we're talking about. If you are a primary care provider and maybe you see this person only once a year for an annual physical, it would be at every visit because you're only seeing that person once a year. If you maybe are a family home visitor who sees someone once every 3 weeks, maybe you're not asking them about their pregnancy intention every 3 weeks, but you ask it every 6 months. It's figuring out what routine means in the setting that people are in. And we're talking about pregnancy intention screening question. There are a few different models for this. One example is one key question, which asks, would you like or do you want to become pregnant within the next year? Another model is the PATH model, which is really thinking about, do you want to become a parent someday? What is that? What do you need to meet that goal? So really thinking about different ways about encouraging folks to think about their more immediate needs related to reproductive health. And also doing that within a broader context of what we call a reproductive life plan. This is not terminology we'd use with the public or patients or clients, but it is called a reproductive life plan, but it's really thinking about long-term goals and values about how an individual's pregnancy intention and their preferred number of children, the spacing and timing of whether or not they choose to have children is related to their overall life goals and values. People make goals about, education, their financial goals, their job goals. How does having a child or another child impact those? How does it fit? What would someone want their life to look like if they decide to have a child or another child or not? And making sure that we're encouraging people to think about how having a family or not having a family fits in with their overall life goals, and understanding that people's goals change over time. So reproductive life goals and plans should also be reevaluated with them. We're really trying to encourage as much as possible, trying to have people think about reproductive health and their goals and needs related to their reproductive health in the context of their overall health in their lives. And part of that is we really want to encourage folks to think about what we call preconception care. Also a term that I don't always love because it's a little bit misleading, because when you hear preconception, you think about, you're just thinking about that time immediately before someone chooses to become pregnant, immediately preconception. But what we're really talking about is health and wellness throughout the life course. Certainly it's about management and interventions that change behaviors that might impact adverse pregnancy outcomes. So, for example, quitting smoking is a good example, or use of tobacco products. Certainly that's something that we want to encourage people to do before they become pregnant or during pregnancy, but ideally we are also encouraging that for their overall health and wellness. And again, we're talking about preconception care. I like to call it kind of health and wellness plus. So it's about being as healthy as possible, regardless of whether or not an individual wants to become pregnant or have a child or become a parent. It's about more than health and wellness. It's about more than reproductive health. It's about health and wellness in general. It's about how do we encourage people to be as healthy and well as possible, but also adding the lens of pregnancy, parenting, family to that. And how those being healthy and well impacts those outcomes as well, and the health of your children and families. The more traditional thing that everyone thinks about when we talk about reproductive health and family planning, which certainly is very important to the work that we do, is supporting comprehensive contraceptive care. That we really want to encourage folks when they're talking about contraception and birth control, that they talk about the full range of method and options. That is to ensure that, people are accessing all methods. We're not highlighting one method above another. To ensure that we're not being coercive at any specific method, but ultimately what we want to do is ensure people have the ability to choose the method that's best suited to their needs and lifestyle. Because part of the reason is that we want to emphasize consistent and correct use. Oftentimes you'll hear, rates of effectiveness for certain methods. There are rates of what we call ideal use. So if someone uses the method consistently and correctly all the time, That's like the ideal use method effectiveness versus typical use. So for example, birth control pills are a method that most people are familiar with. You usually have to take it once a day. You do take it once a day, and usually it's around the same time. But if you're not a person who can remember to take a pill every day, maybe that's not the best method for you. So if you're missing a pill every other day, that is not ideal use. So obviously your method is not going to be as effective for you. So we really want to make sure that people are familiar with the full range of contraceptive options, and they have the option to choose a method that's going to work best for their lifestyle. And that also noting that oftentimes when we're talking about hormonal methods, they do not protect against HIV and STIs. So we also want to encourage providers and other allied health professionals to counsel on condom use as well. Another topic related to reproductive health that we often discuss is healthy birth spacing, and thinking about how birth spacing and pregnancies can impact maternal and child health. That pregnancy is a lot for your body to go through. And the general recommendation is 18 months between your last live birth and your next pregnancy. Part of that is because we want to improve outcomes for maternal morbidity and mortality. We want to reduce rates of preterm birth, low birth weight, and small for gestational age infants. So again, like I mentioned, pregnancy does a lot to a person's body, and giving their body adequate time to recover before they become pregnant again, and kind of going through that physical experience. But there is also a value to what we call more of a social emotional opportunity to develop and bond with the child that you may already have before you have another. Certainly understanding that ultimately it's always an individual choice, and people are and should make those choices for themselves, but also providing this context of why this recommendation of 18 months exists. Because we want to do that all kind of within a broader reproductive justice framework. And reproductive justice, defined by Sister Song, the Women's Collective for Reproductive Justice, is the human right to maintain personal bodily autonomy, to have children and not have children, and parent the children we have in safe and sustainable communities. That we really are thinking about experiences and understanding access to reproductive health care and access to reproductive health services in general are to support individual choice, to make sure that people can have children or not have children, that they are able to parent those children in safe and sustainable communities, that understanding that there have been historical instances of coercion and oppression for different populations and their experience with reproductive health. And I'm very, very sure that everyone is familiar with the recent current events and climate that we have nationwide, and related to reproductive justice and reproductive rights, where the recent Supreme Court decision removed the federal right to access abortion care services, and it is now limited to state decisions. And for everyone's background as well, Rhode Island in 2019 did pass what's called the Reproductive Privacy Act to codify the right to access abortion or termination of pregnancy in the state of Rhode Island. That's not to say we still don't have experience with inequities of access and other challenges, but access to abortion within the state of Rhode Island is protected by state statute via the Reproductive Privacy Act. So other work that we do to support reproductive health and family planning, more specifically, we are funded by federal Title X family planning dollars. Federal Title X is the only federal program that's dedicated specifically to supporting family planning services. We do that by contracting with community-based partners as listed here. They operate 26 service sites throughout the state of Rhode Island, which includes 3 school-based health centers, as well as a project at the Women's Corrections Facility, and other, certainly, of course, many, many community-based health centers that are distributed throughout the state. More specifically, Title X and family planning seeks to serve individuals who are either planning to prevent an unattended pregnancy or achieve an intended pregnancy. And again, that's to assure that they have the information and means to exercise personal choice in meeting their reproductive health needs, or more specifically, determining the number and spacing of their children. And really, we very much focus on supporting what we mean by unintended pregnancy are pregnancies that people have identified as mistimed or unwanted. Mistime also means that folks did not want to actually become pregnant at the time they became pregnant, and unwanted is certainly a pregnancy that they didn't desire at all. And we do that by ensuring access to high quality, comprehensive, affordable reproductive health services that are also confidential. And Title X is supporting services for all Rhode Islanders. Oftentimes, I think there's a little bit of a misunderstanding that it's only for adolescents, but it is for any Rhode Islander who is seeking reproductive health services. A core component of that is ensuring access to confidential services. This is probably why some folks think that Title X is only for adolescents. Confidentiality does impact minors most, but confidential services are also accessible to anyone, including adults who may not want their partner to know. But the core part is that minors are able to access family planning, reproductive health services without parent guardian notification or consent. And this is especially pertinent in Rhode Island because besides the federal Title X regulation, Rhode Island does not clearly outline access to confidential services for minors, except HIV and STI testing. Minors who are 16 years of age and older can consent for their own care, but that does not mean that care is confidential, again, except for HIV and STI testing. That may mean that, for example, an explanation of benefits is sent home, and now their partner or parent or whomever would know that they receive services. There is a current Rhode Island statute that is working on being implemented that would allow for a modified explanation of benefits or suppression of an explanation of benefits. And what I mean by explanation of benefits is, if you go to the doctor's office, your insurance company is going to send you a letter home that says you went to visit a doctor and you got this lab test and you got this physical and you were seen for this purpose. So a modified explanation of benefits would not specify what specific services were offered, but there's also an option with the new statute to change the address to which it's sent to suppress its sending to a home address, or suppress it from being sent at all. So that's to ensure protection of confidentiality, not just for family planning services, but for folks who might, have other sensitive services that they don't want people to know about in their household, or people who may otherwise, be experiencing unsafe situations at home. But more specifically, Title X does support that through federal statute and supports that within the state as well. The other key component to Title X family planning is that income insurance status are never a barrier to service. What that means is for folks who are uninsured or folks who are confidential and don't want to use their insurance, they're charged on a sliding fee scale based on family size and income. And another key component to Title X is ensuring that income is never a barrier. And we do that by ensuring that folks who are uninsured and or confidential and have an income less than 100% of the federal poverty level can receive family planning services at no cost. And our core family planning services are reproductive health counseling, contraceptive care, pregnancy testing, HIV, STI testing, and other kind of related preventive services. We really want to ensure primarily that income and insurance status are never a barrier to care. As I mentioned, these numbers are actually, this is actually inaccurate. It is 26 sites now, but they are located again throughout the state of Rhode Island, and have multiple locations that support access, and also we always kind of like to share the whole list of sites because we also want community-based partners to think about sharing all the options for care, because you never know if someone wants care outside of their immediate community, especially a minor who maybe doesn't want to go to the health center that's like a mile down from their house because they're going to see their neighbor there or their mom's best friend or whomever. So we really want to think about making sure that we have an understanding of where the services are located throughout the state. Other resources that are available with RIDOH support is an app called Right Time, which has been developed by our program together with the Center for HIV STI. Sorry, there's a typo there, but it provides information on sexual and reproductive health services, specifically on STIs, HIV, on family planning, reproductive health, on birth control, health, relationships, and consent. It links to a partner notification option. So there is an option. So if someone does test positive for an STI, it links them to a website where they can enter information on their partners, and that will send notification to their partners that someone suggests that you get tested. There's an Ask the Expert feature where people can submit questions and they will have an expert respond to them within a couple of days. It is mostly anonymous. They don't have to provide any name or other identifying information. They do have to provide a phone number to text, or an email address so that we can respond to their question. So it's not a messaging platform, but they do have to submit a phone number or an email address where we can get back to them. But it's another feature that we support. There is also an accompanying website for folks who don't want to download the app. The app is available on the App Store as well as on Google Play for iPhone and Android users, but there is an accompanying website for folks who do not want to download the app, and has most of the information from the app on a readily available website, including some of the features to ask the expert as well. And the app also has a map where you can search for places to get services and places to get free condoms. So I'm going to make a little bit more of a transition again, because again, we have the 3 programs that are distinct but related, and talk about school health. And what we ultimately try to do at RIDOH is, school health is a bit of a smaller program. It is not a well-funded program, but ultimately what we're trying to do is support the health of school-age youth and the connection between health and educational achievement. And again, we do that by supporting policies, programming, and partnerships that foster the growth and development of students. A lot of the key partners for us are the Department of Education, the local education agencies or districts. We work very closely with the Rhode Island School Nurses Association. We coordinate with school health and wellness committees. All school districts and school committees are required to have a school health and wellness committee. And a really key partner for us is around Healthy Schools Coalition, who has a breadth of experience working with all of these partners and providing support, policy development and professional development for all of these partners. So what we do within the school health program is we focus on assuring compliance with the school health regulations. The school health regulations are co-promulgated by RIDOH and RIDE, the Department of Education. It's really to ensure that school environments are healthy, that school screenings are happening, that in accordance with evidence-based standards, that we are thinking about other things that impact school health, and ensuring that school districts or LEAs, local education agencies, comply with those regulations. To support that, we also provide technical assistance for school nurses and other allied school health professionals, and that includes professional development, that includes policy research, it includes any other additional support that we can provide. And ultimately, we really want to think about how we're partnering with schools, how we work with the other state agencies, and how we work with other community-based partners. That RIDOH is often not the lead in all of this, but we really want to make sure that we are at the table with these partners and thinking about how we can best support them, and then take a lead role when appropriate. And another thing we want to do is really ensure that we're thinking about how we're promoting meaningful engagement with students and families, that ultimately they are the people at the center of school health, and how do we best support them and their needs, and understand what their priorities are related to their health and wellness. And ultimately, there are, again, multiple programs across RIDOH that support initiatives and engage programs that are related to school health, and how do we support that alignment across the department, and also provide support for our different programs that are impacting youth and school-age children. So that is the end of my very long spiel. I'm going to stop screen sharing and pause to see if there are any questions. I know I went through a lot and also like jumped around to a few different topics, but you can also see a snapshot of how my day goes because I jump between the topics a lot. Questions? My email is there. Sorry, I stopped screen sharing, but you can find me on RIDOH's Outlook, and I can pop my email in the chat in case it's useful for folks. Sorry, my caps lock is on, but I already started typing and I'm just gonna send it. But feel free to reach out if you have any questions, you want to learn more about any specific activities that we're doing related to any of the above that we just discussed. Happy to talk more through any of our initiatives and priorities with anyone.
Great. Thank you so much, Sumi.
Thank you.
Everyone have a good day.
Thanks.